Yep. Go. Sign it off. We still have 2 brain scans to go. How's the streaming? We are 32 minutes in. We've gone through a bunch of brain scans. I'm already downloading the next one. It's a 53-year-old male. This is an enhanced brain scan, and he has some clinical history, I guess. It says he has temporal lobe epilepsy. He has had acute seizures for the last 15 years. So he uses a bunch of stuff, and he had a CT scan that came out normal. So we are looking for temporal lobe sclerosis, most probably, or some sort of presentation lesion that could justify a secondary epileptic syndrome. The right lateral temporal horn of the lateral ventricle seems asymmetric, and the head of the hippocampus seems odd to me, maybe a bit sclerotic, maybe a bit bright on T2. There are tiny foci of gliosis on the deep white matter of the frontal lobes. T1 seems fine. This is flared. This is T1. So T1 seems fine. This is a quite normal brain. Let's go for a T2 star gradient echo sequence to look for abnormal mineral deposits, calcifications, and old bleeding sites. Nothing major. Diffusion weighted sequence. Let's roll up and down, see if there is any signs of restricted diffusion compared to normal brain parenchyma. No, nothing like that. This is a T2 sequence. Indeed, there is some asymmetry of the anterior portion of the right mesial temporal region. Let's go for the coronal. Oh man, this is such a bad coronal, but still I can see there is a the hippocampus. It's shaky, it's malpositioned, and it's low resolution, of course, because why not, right? Why make my life easier if you can just make it crappy and harder? So why not make the radiologist struggle? They could have done just this sequence good enough so I can readily do the diagnosis and move on with my life. But no, they have to make the single most important sequence the worst of them all. Of course, why not, right? Why not? It's just so there is an abnormal morphology of the body and the head of the hippocampus. It's a tiny bit brighter than it's supposed to be, irregular and reduced in size. So this is a classic appearance of a hippocampus sclerosis. Oh, they made another sequence and it's even worse. And they tried to do a axial sequence that makes no sense and it's also crap. And then they did a volumetric T1 sequence, contrast enhanced sequence, which helps no one. It helps no one, and there is no freaking need for contrast enhancement in this case. But as you guys can see, this this temporal lobe is screwed over. It's all distorted and sick. So this is the cause of the temporal lobe epilepsy. And of course, the CT scan report, it was wrong. I'm sorry, but it is what it is. They should have seen this on the CT scan, but they didn't because they didn't look for it. This isn't a tiny mesial temporal sclerosis case. This is a very clear and easy to see even on a CT scan. There is no excuse for that. Hippocampus on the left,